Thank you. So my background is as an industry analyst. Most recently, I spent 9 years at Forrester Research in Cambridge, Mass., a local company. We discovered there in 1998, we discovered the internet. We said it was going to change everything, and in fact, it did. In 2011, I proposed a research report to AARP, which they sponsored, called Connected Living for Social Aging, Designing Technology for All. Unfortunately, what happened after that is we saw a lot of technologies emerge into the market, which I would say were designing technologies for none, or for young designers in companies who were designing for themselves. And what's happened, in my view, and the view of many others, is the user experience has been deteriorating since then. And it's gotten to the world of pinch, tap, type, swipe. And for those who might have vision issues, those who might have a slight tremor in their hands, the tap and touch world is actually not technology designed for all. And so we discovered the Amazon Echo a while ago and proposed another report to AARP, which was the future of voice first and older adults. And they said this would be a great report. We discovered this idea of writing this report and doing research on it in February of 2011. Not 2011, February of 2017. And we're all ready to start, and in fact lined up the interviewees, and the group that was sponsoring this in AARP was eliminated. So instead of scrapping the project, went ahead and did it anyway, and you can find this on my website. My website will show up at the end. The report is free to everybody. It's called The Future of Voice First Technology in Older Adults. And that research got me into this sort of mindset that the beneficiaries of voice-first technology are first and foremost going to be older adults and people with disabilities, and then everybody else. So a long time ago, when I wrote my first report in this space, I segmented the market into categories and showed them in a puzzle structure, and the idea of the puzzle structure was to say that without one or the other of these puzzle pieces in that structure, people were not going to have a successful aging experience. And over the years, the structure has remained the same: communication and engagement, safety, security, health and wellness, learning and contribution. But what's happened is the list of technologies in each of those components has grown. And really, what we're talking about now is this is our tech life, and it's a mess. If you look at the upper left in that laundry list, and you look at the upper right at that laundry list, the bottom right, these are, a lot of them are incompatible technologies, multiple vendors, and it's really, smart speakers and voice assistants have just been added to the existing mess. They didn't replace that mess. And so it's pretty important to know, though, that as we age, we are going to become increasingly dependent on technology. And in fact, you know that bank branches have closed in many regions of the United States. You know that Social Security offices have closed. You know that there's a trend to moving people to online sources to do transactions that they were never prepared to do, and that the user interface for the devices they were interacting with are not accommodating. So if you look at the population today and our dependency on technology, by 2020 we're going to have 50 million people in the United States who are age 65 plus. Women are going to live on average, independent of chronic disease, to 88.8. Men are going to live on average to 86.6, again, independent of chronic disease. That's with chronic diseases. And financial planners are now advising people to plan to live to 95. That's a long life. And that's going to be a lot of technology interactions in order to just function, do anything. And what we want is a better user interface. So if you look at the and this I published in the first report I did in 2009, that we have a set of relationships that need to be better connected than they are. If you look at seniors at the top of this, and the providers of services, including healthcare services, at the bottom left, and you look at family and caregivers on the bottom right, we have an opportunity with voice-first technologies to finally connect those folk in ways that, in fact, are accommodating and acceptable to the participants. And if you think about the fact that 46% of women in the United States age 75 plus, live alone. Lack of social connection not only harms health, we've already heard that, but it turns out it's loneliness and social isolation are the equivalent to smoking 15 cigarettes a day. It's worse than obesity, and it's predictor of cognitive decline. And I think all that has been attested to in the research. I'm not doing that research, thankfully, everybody else is. So you enter the voice user interface after a world of evolution from really bad user interfaces or no user interfaces. Look back at character mode in the 70s and the GUI. That was 1977. And then you look in the 80s at the GUI, and 90s we had the web, and that was when Forrester wrote, you know, the internet changes everything. And then we got a worse world. We got mobile. And the good news is we can get around with our devices and leave the building. The bad news is the user interface shrank and became imprinted upon glass. Really, when BlackBerry kind of lost its market cachet, we were left with incredibly sensitive glass. And you all know that you can butt dial, and you can accidentally start up things, and you can be shocked at what happens as a result of your touching a glass device. And so where we are today is in this pinch-tap, zoom-soft keyboard world where we are always getting messages that say, sent from my iPhone, apologies for the typos. Or the fact that there is a new version of software that we have to then download, upgrade, and then rinse and repeat. And often very quickly because security holes have been found in the latest version of the thing we downloaded and we upgraded. And 3/4 of the United States population today has a smartphone. But it is not an appealing interface. It's an interface we suffer and we do battle with on a regular basis. And the more frail we are, the worse our vision is, the shakier our hands, the more prone we are to screwing it up. So voice assistants have now begun to change that, and we are in this hyper-adoption phase. That's the voice user interface at the top. And we are now speaking and speaking up to our technology, which my personal opinion, for me and everyone I know, is a breakthrough. But when I look at the older population, those who are wheelchair-bound, those who have motor skill issues, it's remarkable. So I'm not going to beat the horse on this. This has a very low adoption number by baby boomers, all the way over to the right of 10.1% discovering voice assistants in 2019. I think that's low. So why does voice first matter now? Well, this is the first technology delighter, and for those of us who have been in the technology industry for a ridiculous number of years, it's very rare that we see a new technology introduced that we say, this is a delighter. We say, this is a new release, pain in the neck. This has new features, but we do not use the phrase delighter. When you can speak to a device and hear a response, any response, even a stupid response, is better than no response. And now we're getting smarter responses. So by the end of 2018, Gartner is now predicting, or somebody's predicting, that 30% of interactions with technology will be through conversations. By 2020, 50% will be through conversations with devices. 90 million smart speakers, maybe that's already an old number, in 2018. Most car models now are coming with either Android Auto or Apple CarPlay or whatever you happen to want. The list of models, if you go to those websites, is very long. We are already in a situation where for people with disabilities, we can turn on the lights, the TV, change the temperature, play music, read books, and all do it from a position in a wheelchair in which you don't have to touch anything to make that happen. And the mitigation of social isolation, I've already mentioned, improving quality of life. One of the people I spoke to for the research report, The Future of Voice First Technology in Older Adults, at the very end, there's a narrative about that gentleman's experience introducing a voice technology to his mother who'd had a stroke. She was wheelchair bound, she was in a nursing home, and he introduced the ability for her to speak and put a light on outside her door so someone would come to help her. She could adjust the temperature, she could turn on the TV, she could play music, she could play games, and she could do all of this in her room without Wi-Fi in the building. He enabled it just for her. interestingly, when he was all done with this whole initiative, he asked the nursing home if they would be interested in him deploying such a thing for the rest of the nursing home. And their answer was no. Now, why do you suppose that was? It's work, it's IT, it costs too much. So in the end, she's the only one that got it. So there's a major change in improvement of quality of life. And I'm not going to wander through this pile of pictures because this is what we've got today. We've got devices, interestingly, and software, which is separate from devices. I heard a vague rumor that Amazon might get rid of the Echo Show. I hope anybody who knows anybody there says, big mistake, don't do that. You've got Bixby, who's kind of a dumb thing right now, but is getting smarter. I mean, I spend more time trying to figure out how to disable Bixby on my phone than I care to. You've got Apple, Siri, HomePod, Cortana, Orbita, Unaliware. Unaliware is a watch you can talk to. You know about Orbita is in the health space, and Koita Health is a new entrant with an offering. And of course, you have LifePod, which is the only proactive capability in the market today. One hopes that at some point in the future there are others that will speak up before you speak to them. But that is a complete differentiator. And all of these senior living firms in this picture are piloting voice-first technologies. The real innovator in this was Carlsbad by the Sea, an independent living community in California, which was approached by Front Porch, an innovation organization, to see if they wanted to try out the use of home automation technology with the Amazon Echo environment. They did a pilot. That report is on my website as well as their website about the user experience with being able to turn on the lights, play music, interact with your family, make a call, and improve the quality of your life, even from your automated wheelchair that you're rolling around in and what have you. So that was a breakthrough. But now all these other organizations are piloting. And the other pilot that's going on well, there's two other pilots. There's the Optum one, which I'll mention in the next slide. And then there's the ARP Foundation pilot that's going on for low-income elderly in the Baltimore and Washington, D.C. area, under the theory that mitigating social isolation among the low-income elderly will be a way in improving health outcomes for those people. So I've looked at a lot of these. Now I did hear the Cigna presentation this morning, and I had previously found answers by Cigna. I would say that if you look at all of these collectively, where they are today is what I would refer to as the experiment stage. People are trying things out. You can see a variety of them: WebMD, Cleveland Clinic, Optum Care. Optum Care is kind of interesting. That has something interesting, maybe in a good way, maybe just interesting. They have something called QuizMe. And QuizMe is a capability that enables the user to basically say, quiz me about my grandchildren. Quiz me about my family. Because some previous data has been loaded that is about that, and it's intended to encourage remembering and memory health. So the reason I called these experiments, and I'm not the only one, is mostly not HIPAA compliant, and so they're mostly answering questions that are useful questions. Nothing wrong with the questions. What's a formulary? What time is therapy? What's on the calendar today? And I'd say this is the state of the art in 2018 and will not be the state of the art in 2019. We're going to, as we heard today from Cigna, things are going to move right along. And they're offering services like where's the parking lot, what's visitor guides, how you pay your bill, where's the nearest urgent care. Not that any of those are bad things to answer. They're all good things to answer. But we haven't quite got to the stage of possibly what we really want to know, which is about our own situation. And if you want to read a rather amusing put-down of the role of Alexa in healthcare, you can find a report which I read yesterday called Alexa is a Terrible Doctor, and it's published by Quartz. It's interesting. People want to say this technology is not ready for prime time, especially in healthcare. But when is prime time? if you look at the evolution of the other phases of technology I showed earlier, they were very slow changes from phase to phase. Took a decade, really, to get the web to take off, and then another decade before it was really useful, and then another decade before it was really fast, okay? Mobile took off more quickly, but this is making mobile look like a really slow boat. And so, so what we really want to get to is the next stage, which is not just how do I treat a fever. This is a WebMD thing, or Cleveland Clinic, prevent a stroke, how do I manage diabetes. Where we want to get, of course, has already been talked about today. I want to understand my fever in connection with my chronic disease or my illness, and what are my medications that could mitigate it. What is my health information that could be used to be given to me if I've had a stroke, my medication for my diabetes. So we really want to get into the world of me as the patient, and I think that'll happen, and apparently it may even happen in 2019. So what do we want from voice technology? Well, that's an interesting question. I think these things they categorize the categories of what we want. How will we know when we got it? It's not clear to me we will know in a year, but eventually a lot of this will all crystallize and come together. So we will not be seeing one-off solutions that one does, where's the parking lot, and another one does, tell me the formulary, and another one does something else. We will be able to get what we want, which is how portals have been evolving for years and years and years. Everybody's had a portal for this and a portal for that, which really encapsulates what people ask and what they want, but then they don't use it. So how can we provide people through voice what they want? How can we be proactive and reach out to caregivers and care recipients in the way we've heard LifePod does? How can we be knowledgeable and answer the question we really want to ask? Okay, that was a superficial question. Now I'm going to remember the context of what you just said, and I'm going to tell you what you really want to know. Did you really want to know more about this treatment? Okay, now I'm going to remember that context and the two prior questions of what you asked, and I'm going to refine my answer that is specific to what you really want to know. We want technology to be sociable and smart with us. Knowing about our health, knowing about what we've surfed and searched for, knowing about our preferences, and ideally knowing about our mood. You saw the LEQ image up there. This is an example of a robotic device that is designed to be in the context of changes in the mood of the user. There are avatar technologies that have been entered into the market that are intended to understand mood and opinion, how we feel, what do we really want. I don't think we've gotten there. That's another evolution. That may be after 2019. We want technology that is predictive. We want it to know what we need next and not after an incident has happened. It's great that we can have a technology that we yell at and say, I've fallen and I can't get up, okay? But we'd like to know that Mrs. Smith was released from a hospital with a knee operation. We'd like to know that her gait has been sensed from a sensor that's on her body and that her gait is not really good. She's not back to normal. And she's had what they call precursor falls. You all know about precursor falls? That's the fall that doesn't generate a hospitalizing injury, okay? We know that she had a precursor fall. We know that she fell suddenly onto the couch. We know these things. We haven't acted on them, but they are part of our knowledge base about Mrs. Smith. And after a certain number of those incidents, which is really what Phillips was going to do with CareSage, we know that we need to have a nurse call her up and say, Mrs. Smith, you possibly are at risk of another incident that would affect whether you're hospitalized for your knee or your hip. Maybe we should come and see you. We want technology to be process aware. We talked a lot about the fact that we want to integrate with other data in order to provide the best response and interaction with a person. But what we really want is the technology to be part of an understood process. All the technology that you've ever used in your life that was effective in the business or healthcare world has a documented process. Who does what data is used in that process step, where does the data go, who is notified, and what is the next step. And right now, we are very transactional. We say some data, we get a response. That's a transactional interaction. But every one of our questions and our answers ultimately is part of a process that has to do with us, whether it's our healthcare or our lives. And we want to know when to hand off and to whom, and that we, the user, have opted in and provided the permission to enable that access to the other data that's useful. So that may be all I have to say about that. I would like to see people take a look at that report, The Future of Voice First Technology in Older Adults. I think it's important to understand why the older adult market gets such a big benefit out of this, much more so than the 30-year-olds and the 20-year-olds, because they have not been provided decent technology to interact with. And I include the iPad in that, because anybody knows where the little arrow key for the back arrow is on the iPad, and the other characteristics of devices like that. The screen is beautiful once you get it to show what you want it to show. But the startup and the interaction with it, and the setup of Wi-Fi, and we haven't even talked about today at all about the fact that really great voice experiences are going to happen in environments enabled with Wi-Fi. What's the penetration level of Wi-Fi among the older adult population, and who is going to make it happen? Let's just say it isn't 100%. Who is going to make it happen? FCC has just done another big project, was announced yesterday with people in rural areas and people low income. I think that's going to be a real factor in providing voice-enabled services that provide the correct response for the physical region in which you live, even if it's in a rural area, and maybe especially if it's in a rural area, where you may have less access to a wide variety of services. So at that point, I will shut up briefly. And if anybody has any questions or thoughts about this, I'd love to discuss. One more observation I would make, and it's frustrating to me because now I've been in the space now 10 years, the older adult technology space. So you've got technology for older adults. You've got the phrase aging in place, which I didn't coin, okay? I didn't coin it. But that aging in place moniker and aging. And in the world of aging and aging in place and that world, there is no hard deadline. Okay? There are no goals. Everybody ages, and it's over a period of time, and the service providers who deal with those people have an endless amount of time to impact changes in that overall market. Now you go over to healthcare and everything, digital health and everything else. And now we're going 100 miles an hour, okay? Change is constant. Money is flowing. Everyone's in a hurry. There are many deadlines. Some of them externally imposed, some of them just by organizations themselves. The fact is, older people need health care. Many of the people who get health care services from the healthcare world are older. We can do this. We can think about these things in a much more unified fashion than we have so far, and I'd like to see it happen. I'd like not to see events dedicated to voice and healthcare and events dedicated to technology for older adults, which I've been going to for a long time. I'd like to see an overlap, a merger, subtracts, and ways of thinking about the fact that this is a holistic opportunity for everybody to do a better job in delivering care, period. And that's all I have to say. Now that's all I have to say. We have 5 minutes.
If you have questions, there's the 2 mics. I want to ask you one real quick myself.
Sure.
The Saturday Night Live spoof with the senior citizens asking asking Alexa and all that. Share your thoughts, whether you liked it, whether you didn't, whether that helped people more widely understand, how older folks would be interacting with the technology. What was your take on that?
You really want to know? Yeah. I thought that was appalling. That was an ageist piece of crap from Saturday Night Live that diminished a view of older adults as being unable to understand or communicate clearly. Now, was it funny? It was really funny. Okay, I don't disagree with that. But the fact that I think it's segmented a perception of older people, Alexa, Alicia, whatever the heck your name is, that's pure, simple, disparaging ageism. Yes?
Yeah, hi, thank you for the talk. Can you speak a little bit about the difference in how technology can help breach some of the differences between like rural aging versus urban aging? Because it is, in my mind, a different experience. And you see a lot of different challenges, so.
Yeah, well, not the least of which is the high-speed internet access in some areas, which is, you know, it's amazing really how much money and effort has been applied to extending high-speed internet access into rural areas, and yet we still, in 2018, are seeing statistics about underpenetration and not yet rolled out. So let's just assume it was rolled out. There was a high-speed connection in all rural areas everywhere in the United States. If that were to happen, that's just job one. Then you have to have all the rest, which is, you know, Wi-Fi access in the home, devices at a price point that people could afford to buy, you know, routers and things of that ilk, a device in which to actually interact, which is great that the Amazon Dot is $29 or whatever it is now, and the Mini is, Google Mini is similar. That's great, but that goes with the high-speed internet access into the home, which has a monthly cost and is not free. So I think we haven't yet made the kind of real interested engagement on the part of the agencies that are trying to make this happen. Not that they don't want to, they're trying. Yes?
Hi, thank you for sharing your vision and your thoughts on where aging technology lies. Have you given any thought to the liability, like where you think that plays and how that's going to factor in developing for the aging population?
You mean giving the wrong answer?
Yeah, giving the wrong information, misinformation, causing issues.
Yeah, you know about, is it the Cigna one that has the disclaimers in it? Or maybe it's another one that I was looking at that has plenty of disclaimers. This information is not to be construed as a diagnosis or, yeah. You know, everything we do and communicate has a liability associated with it. It's only really a problem if someone sues, right? Otherwise, we can forget about the liability. But we can provide wrong directions. We can say, turn left up there where there's no left turn. We can, in our entire experience with the world, there is potential liability and risk, especially when we interact with the business, and the business could be the healthcare provider or any other business. We could fall down in a store and sue them. I think this is an excuse when people think about that. Same with HIPAA. This is actually an excuse. I like the idea of photographing the medical record as a way of getting around the HIPAA restrictions. You know, people need their information, and so I think liability is a barrier. It's a false barrier. Yes.
Hi, really good presentation. So I'm curious. I completely agree that, you know, smart assistants help to empower our aging population, our disabled population. I'm curious, where have you seen, you know, in terms of the initial adoption with the elderly folks that are adopting this, what challenges do they have, and how are they getting around that, you know, in terms of starting to use something like smart speakers, smart assistants?
Well, the biggest complaint that everybody makes in the context of older adults is that they're worried about their privacy. They don't like something listening to them all the time, and you know, it's a privacy violation, which I usually say, when you pick up any device, your privacy is encumbered. And so is this worse than those? No, this is a listening experience that you think of as an invasion of privacy. And frankly, I don't think we have yet got the good interface to tell it to shut up or stop listening. To have to go over and tap a microphone, or if you have 5 microphones in your house, to tap all your microphones, to have them stop listening. You should be able to yell, and I think you can do it with the Google environment. Stop listening. Stop listening. Rather than turn everything off and then have to remember the next day to turn it all back on. So our interaction is rudimentary. And privacy is the big worry that I've heard expressed over and over by organizations and people that deal with older adults. They say this is a privacy risk, but I think once you get past it, it's a delighter. And the thing about delighters is you forget about the privacy risks. Yes, sir.
We've got 3 Echo shows at my parents' house. They're 89 and 91, and I can drop in on them by room, and they love it. You know, they sit in the kitchen, and we just sort of show up. Do you know of any assisted living or independent living communities that are using the show in creative ways? And also, I was concerned that you said that maybe Amazon's going to phase out the show. What
No, I
what's
just
up
heard a rumor that. You know, please, if that was a rumor, I'm repeating it in the fact that somebody here may actually talk to somebody at Amazon and say, don't do it. What was great about the show, aside from actually responding verbally to what you asked, it displayed the answer in a large font. So if you had it on the kitchen counter, you could read it, you could hear it, and plus it has some visual stuff. You know, how do you make a souffle, or how do you make a fried something or other dish? That's good too. So I think the show is a wonderful thing. Some of these organizations may be trying the show. Honestly, the only reason I know about these organizations is because they are interested in people knowing about their pilots. Okay? And there are articles I can find about their pilots. There may be many, many more pilots, including personal use of a show in a particular unit in the building. People are looking at the Echo for concierge services. So you walk up to the front desk in a senior living environment and you say, you know, I'd like to participate in the 2 o'clock activity. You know, concierge services is clearly I want a handyman to come to, or I have a device in my room, I want a handyman to come and fix my shades. There's an endless opportunity in that regard, concierge services. So, okay. Yes, ma'am.
Thank you very much, and I want to thank you for your column, which I've read, I think, since the first time your blog, since the first time it came across my desk. And what I like about it is that you not only are a real first alert service as to what's coming along, but then you puncture the hype. And you do a really good job of puncturing the hype and putting a realistic spin on it, which I think is very good. So there's a plug for your blog. I want to pick up on something that John said, that you've said repeatedly, about understanding what I want, or that what the user wants. You heard me say this earlier. And both in the areas of the health context for older people and the non-health context. One complaint about in the non-health field is if you look at what Amazon is developing and the questions that come out, you know, I have several Echoes and Dots, and you know, you get your weekly, what's new with Alexa? Well, it's pop culture and it's sports. You know, I don't know pop culture and sports anymore, so it's not coming up with suggestions on a routine basis that would be of interest and keep me engaged and lively, and I don't know what its games are, so I don't know if you see more of that coming, if there's a way to find that. I have another follow-up question in the health field, but let's stick with that one first. Do you think they're doing any better job of that?
They are doing a better job of that, and frankly, one of the great things about being a cloud-based service is they're not telling you that next Friday it's going to be better. That they're going to add more answers.
Oh, good.
Or they're going to play more music. Or they're going to do more music that's appropriate to you. The big problem with the environment now is if you actually go to the Amazon website and you look at the skill structure and the list of them, I wouldn't call it chaos, but it's not helpful in figuring out exactly what they offer. So the capabilities are evolving. The information about those capabilities that's evolving at a much slower pace.
It just occurs to me as you were talking that one of the things that they could do is in your setup app, you could fill in a little bit of demographic or other preference information, and then they could feed it back to you. That would be a very simple thing for them to do.
Right, and if you started doing any of the things about recognizing your voice, I don't know if you've gotten into that at all, but you can train your voice. So it's, I don't know whose device this is, but that's Laurie speaking, and Laurie likes the following music. Would you like to hear one of Laurie's music pieces?
I might not even mind them knowing my age, is what I guess I'm getting at. So, but in the health field, again, it's increasingly known in the medical field that patients' preferences are primary contributors to good outcome. And yet docs always feel that they must follow the clinical guidelines, and if it's an inpatient experience, they're going to be dinged if the patient comes back after 30 days, so they've got to do exactly everything that they thought they did, whereas in fact, if they did more about what the patient wanted and valued, the overall outcome might be better. My question is, do you know anyone in your knowledge of people working in the health field, or maybe this is for the developers in the audience, who is finding that sweet spot for, at least looking forward, it's not there yet, I know, of being able to truly integrate patient preferences into the type of content and interaction that's built in.
So I have a suggestion in that context, and that is that your medical record is not your profile. You should have a non-HIPAA compliant profile, just like you have on Amazon's site about what music you like and everything like that. That could be your social profile. We'll just call it that for the moment. And interactions with the healthcare system take into account your social profile when presenting information to you in the social profile ways that you prefer. Right now, we've bundled all that stuff together, and we still have a clipboard, for heaven's sakes. I mean, you know, it's a slow evolving world. But the idea that you would have a profile that's independent of your medical record profile would enable this interaction model to be appropriate to you.
Well, just as one example that again jumped into my mind as you were speaking, if it knew that I were a very physically active senior,
Right.
and we had gotten to where you wanted to be, where I'm getting information about my diabetes or my anything else, but it knew I really
Right.
liked activity. Instead of feeding me back all the pharmaceutical approaches, it might first feed me back the physical activity and nutrition choices.
Take a walk, yeah. Integrate with MyFitnessPal. Yes, ma'am.
Hi.
Is
thank
this the
you
last
very
one?
much. Last
Yes,
one.
last question.
I was just interested in finding out who provides precursor fall technology.
Who provides precursor fall technology?
Yeah, you said there was some kind of device.
No, there's a
somewhere.
category called precursor falls, which are the falls that occur prior to the fall that causes the injury. And there are a wide number of companies that have fall detection built in. Great Call, Philips, Mobile Help, a bunch of others make fall detection capability that is, if it's worn on the body and you fall, it has something built into it that detects the pace of change and assumes that you're on the ground as opposed to you just sat down.
Let's give Laurie a round of applause.
Thank you.